When you think of surgery, you probably picture a modern marvel, right? Sterile rooms, precision tools, and best of all, painless procedures. It's a world of laser scalpels, robotic arms, and anesthetics that let us sleep through the most complicated operations you can imagine. But what if I told you the real story of surgery didn't start in the last century, but thousands of years ago, with stone scraps and bronze scalpels? This isn't just a story about medicine, it's a story of grit, genius, and unbelievable courage in the face of some truly gnarly situations. It's the story of innovators who stared down disease, dogma, and even death itself. We'll meet an Egyptian royal physician so respected, his surgical tools were buried with him for the afterlife. And we'll journey to ancient India to meet a sage who could rebuild a human face from scratch with little more than a knife, a leaf, and a deep understanding of the human body. This is the story of how our ancestors turned brutal hacks into the healing arts. Long before surgery was a science, it was basically a terrifying leap of faith. Our story starts way, way back, not in a temple or a hospital, but in the murky depths of prehistory, more than 10,000 years ago. Even before the first pyramids were built, our Neolithic ancestors were performing what's arguably the world's oldest surgical procedure, trepanation. That's the act of drilling, scraping, or cutting a hole into the human skull. Just imagine the scene. Someone is writhing in agony from a splitting migraine, suffering from seizures, or maybe just acting strangely, tormented by what their tribe thought was an evil spirit trapped inside them. There are no painkillers, no antibiotics, no clue what a germ is. The surgeon, probably a shaman or elder, picks up their tool, not a polished steel drill, but a sharpened piece of flint or obsidian. With the patient held down, they begin to slowly, painstakingly scrape away the bone, layer by layer. The sound would have been gruesome, and the risk of infection, brain damage, or death was astronomical. So why on earth would they take such a terrifying risk? Well, sometimes it was a desperate attempt to fix a clear injury, like a skull fracture from a hunting accident. By clearing out shattered bone, they could relieve pressure on the brain. But thousands of trepanned skulls have been found all over the world with no sign of injury at all. For these people, the procedure was likely spiritual, a way to literally let the evil spirits out. And here's the really wild part: they often survived. Archaeologists have found skulls with clear signs of healing, meaning the patient lived for weeks, months, or even years after. Some skulls have multiple healed holes, which means one person went through this horrifying ordeal several times and lived to tell the tale. Survival rates might have been as high as 90% in some areas. It was a brutal act, born from superstition and desperation, but it was also the first brave step. It was the moment humanity dared to cut into the body, not just to harm, but to heal. Those anonymous Stone Age surgeons, with their primitive tools, were the first to cross the threshold, opening a door that would eventually lead to the operating rooms of today. As we move out of the Stone Age and into the Bronze Age, our story heads to the fertile banks of the Nile, to the civilization that gave us hieroglyphs and the Great Pyramids, ancient Egypt. This is where medicine started its slow march from magic to science. While plenty of Egyptian medical texts are full of spells and chants, one document stands out as a stunning piece of rational thought: the Edwin Smith Papyrus. Written around 1600 BCE, but probably a copy of a text from as far back as 3000 BCE, this 15-foot-long scroll is pretty much the world's first surgical textbook. You won't find any prayers or incantations here. Instead, it lays out 48 cases of physical trauma, organized logically from head to spine. Each case is described with amazing clarity: a title, a detailed examination, a diagnosis, and a prognosis. The author acts like a clinical instructor, walking the reader through how to examine the patient. He tells the physician to feel the wound, check its depth, and observe the symptoms. For a man with a dislocated jaw, the text says, "You find his mouth open and his mouth does not close for him. You then place your fingers on the back of the two rami of the mandible inside his mouth. You cause them to fall so they lie in their correct place." Incredibly, that's the exact same method doctors use to fix a dislocated jaw today. The papyrus also reveals a physician who wasn't afraid to admit his limits. For each case, he gives one of three verdicts: an ailment which I will treat, an ailment with which I will contend, and an ailment not to be treated. That last category, for devastating injuries like a crushed spine, shows an incredible amount of medical realism. This doctor knew when a wound was fatal and when not to cause more pain with pointless procedures. This wasn't a faith healer, this was a pragmatist. The treatments themselves were just as practical. Wounds were stitched up with a needle and thread, broken bones were set with wooden splints and padded with linen. And they used honey to dress wounds, a substance we now know has powerful antibacterial properties. So who were these early rational surgeons? While we don't know who wrote the papyrus, the tomb of a royal physician named Scar, who lived around 2400 BCE, gives us a clue. Inside his tomb near Saqqara, archaeologists found a set of bronze instruments buried with him for the afterlife. Now, scholars debate if these were actual surgical tools or just models, but either way, they represent a huge shift in thinking. These scalpels, forceps, and probes were the tools of a skilled trade. Unlike the crude flint scrapers of the past, these were precision instruments. Scar and the anonymous author of the Edwin Smith Papyrus kicked off a revolution in thought. They looked at a broken body and saw a mechanical problem, not a spiritual one. They replaced incantations with observation and magic with method. They were the world's first true trauma surgeons, and their logical approach laid a foundation that would be built on for thousands of years. All right, leaving the land of the pharaohs, our journey takes us east, across deserts and over mountains to the ancient Indian city of Kashi, which we now know as Varanasi. Here, around 600 BCE, we meet the man who would earn the title Father of Surgery, Sushruta. Sushruta was way more than just a doctor. He was a teacher and a true revolutionary. His masterpiece, the Sushruta Samhita, is one of the most comprehensive and just plain astonishing medical texts ever written. In 184 chapters, he details over 1,100 diseases, hundreds of medicinal plants, and most importantly, over 300 different surgical procedures. This wasn't just a simple guide for patching up wounds. It was a complete system of surgery, covering everything from removing bladder stones to plastic surgery. Sushruta's approach was both holistic and deeply ethical. He believed a surgeon needed to master both theory and practice, telling his students to practice their incisions on gourds and leather bags to get a steady hand. He stressed the importance of cleanliness, a concept that was centuries ahead of its time. But his biggest contribution was his insistence on knowing human anatomy, which he argued could only be learned by dissecting a human body, a major taboo in most other cultures. It was this anatomical knowledge that let Sushruta perform mind-bogglingly complex procedures. His most famous technique was for rhinoplasty, or nose reconstruction. In ancient India, cutting off someone's nose was a common punishment. Sushruta came up with an ingenious fix. He'd start by taking a leaf to measure the missing part of the nose. He'd then use that leaf as a template to cut a flap of skin from the patient's forehead or cheek, leaving it partly attached to keep the blood flowing. After preparing the nasal stump, he would rotate the skin flap and stitch it into place. To make sure the new nose held its shape and the patient could still breathe, he'd insert two small tubes into the nostrils. This technique, now called the forehead flap rhinoplasty, is still used in modern plastic surgery, a powerful testament to its brilliance. But Sushruta didn't stop there. He was also a pioneer in eye surgery. He described over 70 different eye diseases and developed a daring procedure for removing cataracts called couching. It involved using a special curved needle to push the cloudy lens out of the way, allowing light to enter the eye and restore vision. Talk about a high-stakes operation performed on a conscious patient who was probably just given wine to dull the pain. But in the hands of a skilled surgeon, it could bring someone back from a life of darkness. To pull all this off, Sushruta needed a whole arsenal of specialized tools. The Sushruta Samhita describes 121 different surgical instruments, a collection that wouldn't be matched for nearly 2,000 years. His genius was in their design. Many were inspired by the natural world, shaped like the beaks of birds and the jaws of animals. He had forceps named after crocodiles and herons for gripping and pulling things out. He had scalpels, needles, catheters, and tools for draining fluid. These weren't the crude tools of the past. They were elegant, purpose-built instruments. Sushruta transformed surgery from a craft into a science. He combined careful observation with bold innovation. He didn't just fix broken bodies, he rebuilt them. The core principles he laid down, cleanliness, education, practice, and anatomy, are still the pillars of surgery today. So, these seeds of knowledge planted in Egypt and India started to spread, carried along trade routes by scholars. They found fertile ground in ancient Greece, where around 400 BCE, the physician Hippocrates, the father of Western medicine, established a code of ethics and further organized the study of medicine. The Greeks continued performing trepanation for head injuries and developed their own specialized tools, like the spoon of Diocles, a clever instrument designed to pull out arrowheads without causing more damage. But it was really the Roman Empire that forged surgery in the fires of war. The Roman legions were constantly fighting, which created a huge demand for trauma care. The Romans responded by setting up the first dedicated military medical corps and building early field hospitals. Here, military surgeons, or medici, became masters of battlefield medicine, treating sword slashes, spear wounds, and brutal fractures on a massive scale. Their surgical kits were surprisingly sophisticated, with bronze and iron scalpels, forceps, and bone drills that look a lot like modern instruments. They used opium as a basic anesthetic and washed wounds with wine and vinegar, unknowingly using their antiseptic properties. The most famous of these surgeons was Galen, who got his start treating wounded gladiators. This gave him a grim but unparalleled window into human anatomy, letting him develop surgical techniques that would remain the standard in Europe for more than 1,000 years. But when Rome fell, a lot of this medical knowledge just vanished from Europe during the Middle Ages. Luckily, the flame of innovation was kept alive in the Islamic world. In the 10th century, a surgeon in Córdoba, Spain named Al-Zahrawi emerged. Often called the father of modern surgery, Al-Zahrawi wrote a 30-volume medical encyclopedia. The final volume, all about surgery, was a masterpiece. He invented or improved over 200 surgical tools, and crucially, he included detailed illustrations of each one, creating the first ever illustrated surgical guide. He was the first to describe hemophilia and the first to use catgut for internal stitches, a material the body can absorb. Al-Zahrawi's work was translated into Latin and became the main surgical textbook in Europe for 500 years, single-handedly pulling European surgery out of the Dark Ages. From there, the innovations kept building. In the 19th century, Joseph Lister introduced antiseptic surgery, drastically reducing infections. Then came stainless steel, providing instruments that were durable and easy to sterilize. The 20th century brought the miracles of antibiotics, blood transfusions, and safe anesthesia. And the 21st century has given us robotics and minimally invasive procedures. The Da Vinci surgical robot, with its tiny, jointed arms and 3D vision, can operate with a precision the human hand can't match. But at its core, it's still just a tool. It's a direct descendant of the sharpened flint used to scrape a hole in a skull 10,000 years ago. It owes its existence to the bronze scalpels of Scar, the forehead flap pioneered by Sushruta, and the illustrated guide created by Al-Zahrawi. So, what's the takeaway here? The history of surgery is really a story of relentless human ingenuity. It's a journey that started with a desperate act of scraping bone with a rock and has led to robotic arms performing life-saving procedures. This path was paved by incredible innovators who had none of the comforts we take for granted. They operated in a world without anesthesia, where pain was just a part of healing. They fought infection without antibiotics, relying on honey, wine, and a prayer. They explored the mysteries of the human body with only their hands, their eyes, and their intellect. From the pragmatic doctors of ancient Egypt to the revolutionary genius of Sushruta in India, these pioneers laid the groundwork for every operation that happens today. They proved the human body wasn't some untouchable mystery, but something that could be understood, repaired, and healed. They turned what was once a brutal, terrifying hack into one of humanity's most profound and compassionate arts. So the next time you see a modern operating room, remember the long and bloody road it took to get there. Remember the stone scraps, the bronze scalpels, and the giants of history who first dared to wield them. If you were fascinated by this journey into the past, be sure to hit that like button and subscribe for more stories about the hidden history of science and medicine. And let us know in the comments which of these ancient innovators impressed you the most. Thanks for watching. Stay curious and take care of yourself.